Hello team, greetings of the day. Today me and Imran are here to discuss about our new product which is Murinact, and we are going to discuss about the product knowledge, what exactly Murinact is, what are the indication is going to work, and what are the dosage, what are the other things we are going to work, everything we are going to in a brief we are going to explain it to you. So Imran, just before we start, I want to know exactly what is Murinact and what it is main chemical composition of Murinact and where it has been extracted.
Yeah. So, guys, Murinact is a phosphoric acid derivative, and it was isolated from the streptomycin species. And phosphomycin, it belongs to a new class. New class in the sense it is its own class. It is unique in its class, and it has bactericidal activity by it acts by inhibiting the peptidoglycan synthesis, which is important for the for building up the cell wall. Okay.
So in a simple way, we can say that it is classified into its own separate class, and it is having the bactericidal effect with by inhibiting the cell wall synthesis.
Yes.
Now, Imran, what are the organisms basically it covers? What are the organisms?
Yeah, as it is a broad spectrum antibiotic, it covers gram positive and gram negative organisms, and gram positive includes Enterococcus and Staphylococcus, whereas gram negative includes E. coli, Klebsiella pneumonia, Proteus malarius, and Pseudomonas aeruginosa. So these are the bacteria.
Yeah. So phosphomycin has bactericidal activity. It covers gram positive as well as gram negative organisms. As Imran has mentioned, what are the organisms covered like E. coli and Pseudomonas and Streptococcus, etc. So what are the infections caused by these organisms? It's definitely going to have a susceptibility and help in the treatment for that. Now, while asking Imran, what are the indications we can use phosphomycin for? What are the indications we can?
So mainly phosphomycin is used for the gram negative bacteria, such as for the complicated urinary tract infection, then nosocomial lower respiratory tract infection, then osteomyelitis, then brain, the infection of brain, that is meningitis, and for septicemia also. These are some indications in which, but we are mostly focusing on complicated urinary tract infection by E. coli and somewhat gram negative bacteria, and this thing nosocomial lower respiratory tract infection. So these two indications are the most important indications for our positioning of this product.
So, like indication wise, what we can say is what are the whether it may be complementary or uncomplementary. What are the urinary tract infection that phosphomycin is better, okay? And also it can be used in nosocomial infections caused by like lower respiratory tract, especially lower tract respiratory tract infection, and any blood infection like septicemia or bacteremia. So we are going to focus on that, as Imran said that. Now coming towards the dosage and its reconstitution and what is the infusion rate, Imran is going to just let us. What is the dosage?
The dosage is 4 grams every 6 to 8 hours, but it depends on the severity and depends on different indication. For osteomyelitis, acute osteomyelitis, it is 12 to 24 grams in a 2 to 3 divided dose, and for complicated urinary tract infection, it is 12 to 16 grams. Okay, in 2 to 3 divided dose, and for nosocomial lower respiratory tract infection, it is 12 to 24 grams in 2 to 3 divided dose, and for bacterial meningitis, it is 3 to 4 divided dose, and the dose is 16 to 24 grams. 16 to 24 grams in 2 to 3 to 4 divided dose. Okay, so here the dose is somewhat bit higher.
So basically, what you can say is the dosage is like 4 grams, 6 to 8 hourly. So depending upon the infection, the dosage in the basic what we have to remember is 4 grams, which is 6 to 8 hours they can use it. Now Imran, what are the compatibilities liquids where we can reconstitute the phosphomycin, and what is the procedure for that?
So for dissolving this thing reconstitution, you need to dissolve phosphomycin in 20 ml of water for injection. Then, for example, 4 grams in 20 ml water for injection. Then you have to give it to a 200 ml what may be it is water for injection or NaCl etc. Then it can be used in 5%, then 10%, 30%, 50% of dextrose and sodium lactate for the compatible liquids, the compatible solvents.
So now you know what is Murinact is, what is phosphomycin, what are the organisms it's going to cover, what are the indication it is going to be used, and what the dosage it is required for the treatment of those disease, and how it is reconstitution. We have learned that. Now how are we going to position it? So which doctors, select a set of doctors we have to use it for the promotion of these products. Imran, what are the doctors, set of doctors we have to
So
use?
yeah, positioning is very important when you are promoting the product. Okay, so our product is fosfomycin Murinact, right? So for fosfomycin, we are concentrating on complicated urinary tract infection and lower respiratory tract infection. So for urinary tract infection, you can promote this product to urologist and nephrologist and intensivist, then IV physician, then general physician, and for lower respiratory tract, you can go with the pulmonologist.
Yeah. So now we have discussed about the medical part of the, in brief we have discussed the medical part of the Murinact. So
In next video,
next video we are going to let you know how are we going to promote with a role play. Exactly, with a role play, what are the things you have to cover for promotion of the Murinact. And definitely we are going to share the soft copy of this and the promotion in the next video. Thank you for your
Okay, so have a nice
listening.
day.
Thank you. Have a nice day. Bye.
Bye.